Let's talk a little bit more about how to care for a wounded inner child. Coming up. Hi everyone, this is Dr. Brett Pearce, child psychologist, and would like to follow up on a video I did about a year ago in which I responded to a very fine YouTube channel that did a video on signs of having a wounded inner child. And very recently they were kind enough to link that video on their channel, so this video is intended to give them a shout out and a big thank you for the kind words that they offered me on that video, as well as to follow up on ways to care for an inner wounded child. You know, I tend to think of concepts like having an inner wounded child as useful, but sometimes a little bit abstract. I sometimes get a little bit cautious about thinking of things in terms that I find a little bit overly metaphoric and things like that. But that goes beyond the purpose of this video. Because regardless, one of the best ways to care for inner hurts, whether they come from your childhood or not, is to think about the way that you treat yourself. Yes, the way that you treat yourself. And there are a lot of people who would never dream of treating others close to them, like a spouse, a best friend, a parent, a brother, a sister, whatever. They would never dream of treating those people in the same ways that they often, without quite realizing it, treat themselves. So it is important when you're thinking about a wounded inner child, which is to say maybe carrying a lot of emotional pain inside of you that tends to originate in childhood, it's important to think about how you would like to feel and how you would like a kid to feel if they were in a lot of pain. So one big point that I would like to make in this video is that it's always good to slow down and carefully listen to how you treat yourself in those situations. One common thing that I see with people, both in my personal life as well as in my practice as a psychologist, is that it is easy to find that enacting a lot of kind of self-judgment, self-criticism, and even almost a lot of active disrespect or even almost hostility towards yourself seems to be a common way of approaching things when someone's in pain. So I tend to encourage people to think about, well, how does it feel when you treat yourself that way? And it starts to get a little bit kind of, it takes a little bit of some acrobatics to kind of think through that. But it's true. It's important to think about being respectful and reasonably understanding with yourself when you're in pain. So let's take maybe a little bit more of a real world example. So there's nothing wrong with reflecting on your behavior and considering what behavior is and is not useful in certain situations, particularly when you've made a mistake and things did not go the way that you wanted them to go. Let's maybe take a fairly common example of things that can be kind of embarrassing and anxiety-provoking and kind of frustrating. Let's say that you made a mistake at work. So it's important, just like if we had a kiddo who, say, messed up at school, the probably fairly reasonable thing to do with that kiddo would be to say, hey, I'm proud of you for thinking about this, and I know it can be embarrassing and make us kind of feel ashamed of ourselves when we make mistakes. And it's also very important to understand that mistakes do happen and that there's nothing you can do to go back and change that mistake. But what you can do is think about how you would like things to go in the future. And what's implied when we say that to the kiddo is that there is no need to beat up on yourself or to be overly critical with yourself. In fact, what I would propose is that there's no real reason to be critical of yourself at all. And what I mean by that is it's much more useful to be critical, if you want to use that word, of behavior, because behavior and self are not the same thing. So in order to help deal with kind of wounded inner child issues, it's good for us to think very immediately in the moment when we're feeling that pain and finding ourselves thinking thoughts that seem to be negative or self-critical or whatever the structure of the pain. And there's all kinds of specific ways that that can look that are kind of beyond the scope of the video. It's important for us to get really immediate and to try to say, how am I feeling now? And what do I need from myself now? And you can think of those in terms of, what does my inner child need? That's fine. If that provides you with a good structure for kind of accessing that way of being with yourself. It's also perfectly sensible to just simply think in terms of, where am I at now? So, shoot, I've made a mistake at work. Shoot, I feel embarrassed. Shoot, I kind of messed things up. Shoot, maybe my boss or coworkers are a little frustrated with me. But it is okay for me to reflect on my behavior and to think of how maybe I could prevent this in the future. But there does come a point where maybe I have to understand that forcing myself to review this over and over and over in my head, when I've already figured out the answer to what's going to be more useful in the future, is sort of like a kind of torture, or a browbeating, maybe, is a better way of saying it. And that's not a great way to treat yourself, and it certainly wouldn't be a great way of treating a kid who's made a mistake and is in a lot of pain. So this is the kind of thing that I encourage people to think about. And certainly, being primarily a child psychologist, these are the kinds of ways that I encourage adults to be with kids, where we try to be in a place of kind of wise, kind of loving, constructive, present supportiveness, where we are certainly there to help learn skills and solve problems, but we're also there to connect and to be supportive and patient, and to encourage a healthy way of relating with painful feelings. And particularly when we're talking about a wounded inner child, in my view, that's probably the biggest thing that we're talking about, is we're talking about how were we kind of set up in a way, how did we learn to relate with emotional pain? What kinds of messages did we receive? What kinds of ways of coping did we learn how to develop? And very often when we're struggling with that kind of issue, we end up realizing that the ways that we learn to handle things, the kinds of beliefs that we formed, the kinds of behaviors that we learned in order to respond to painful feelings, maybe that was the best we knew how back then, but now that we're grown up, we see that perhaps it's not the most useful anymore. For example, oftentimes, speaking of things like being self-flagellating or overly self-critical or being negative about yourself, I think that very often that serves a couple different kinds of functions, particularly when you're talking about having a painful history with authority figures. So it can certainly serve the function to kind of try to ward off maybe others being upset with you or punitive towards you, because if you do it to yourself first, then that kind of, well, now you can't be angry with me or seek to punish me in any way. Second of all, I think it also, in a way, it acts as a kind of inner sort of attempt to absolve oneself of something that one feels like one has done wrong. Very often, people who struggle with these kinds of issues will carry inside themselves a kind of shame, and will frequently find themselves attempting to punish themselves as though they've done something deeply wrong. And there's the kind of attempt to sort of absolve oneself through punishment. But punishment doesn't absolve, it just hurts. And there's a big difference. So at any rate, thanks again, Psych2go, for the kind words about the video. I'm very flattered, and that means a lot to me. I just hope this is interesting, and some follow-up thoughts on a few ideas for approaching dealing with a wounded inner child. Thank you. We'll see you in the next one. Bye-bye.